is one of those sports that you really have to have both strong anchors from your core and a lot of adaptability to your spine. Swimming requires so much rotation, especially with the backstroke and also freestyle. And if you don't have the ability to laterally rotate, or with the butterfly, that if your vertebrae aren't all moving through flexion and extension the way that they should, then you're fighting your muscles and you're not as efficient as you could be. So what I'm going to walk through with you is how to make your spine a little more adaptable, a little bit more able to move and flow like it should, while still anchoring the muscles that give you the strength to pull and to kick with as much power as you need. So the first thing that we're going to do is roll out the muscles that are often inhibiting the movement in the spine and the movement between the rib cage and the pelvis that you need. So if you come to the floor, I like to use a pair of therapy balls together. I like the yoga tune-up ones. There's lots of good balls. You just need something that isn't too hard. You want some give to it and some grippiness. So if you come down to the floor and you place the balls, so the psoas is a back muscle, but it's on the inside of the back, so you have to go through the front. It attaches to several places, several of the transverse processes of the spine, and also to the femur. So if you start here at the iliacus, which is right inside the hip, come down, and then I like to just roll medially a little bit. You can go back and forth, you're cross-fibering the psoas here, and you're working your way down into deeper tissue. Now this can take a little bit of time, so just don't rush it. If you rush it, your nervous system will engage and will not let you into the muscle the way that you need to be. If you excite your nervous system here, then the muscles are going to fight back, and you want them to work with you. So super slow, lots of deep, slow breathing, and then contracting the muscle against the pressure of the balls, holding for 10 seconds, and then releasing really helps to neurologically lessen that tightness. And then if you bend and straighten your knee, that's going to also help to change the length of the muscles because it's attached to the femur. If you run through internal rotation and external rotation of the hip, that's also going to help get more adaptability into those muscles. And this, again, takes some time. So don't be in a hurry here. That's easier said than done. Put on a movie, do some meditating, but take the time that you need in this muscle. Now, we're just doing one side. Take time to do both. Another muscle that really needs to be, so you have the pelvis that is stacked, or the rib cage that's stacked on top of the pelvis. And if the psoas is too tight, it doesn't allow the rotation that you need. Also this direction, but the QL is right in back of the psoas, and that also needs to be released. There's a couple of ways that you can do that. So you're looking at this area above the pelvis, below the rib cage. That tissue is the QL. If you take a small Pilates ball, place it on the side of your spine in that area between the rib cage and the pelvis, and now you're just going to breathe. So I'm trying to put most of my weight through that muscle, through the ball into that muscle.
But it's really important to just hang out here and do some deep breathing. So you're going to really inflate your rib cage. Fill it with as much air. Spread your ribs as far apart as you can get them. And then slowly exhale. And I recommend doing a full minute of that. You can even do longer. So as you put pressure into this QL, again, really just focus on letting your nervous system relax. And that's going to help release that muscle. After you've spent some time with the small Pilates ball, you can use a little more direct pressure. You can use the smaller balls, and I'm going to just really push with my opposite foot, really push that tissue into the balls. And again, I'm going to breathe. I'm going to tuck my pelvis and then go into a little bit of back extension, just back and forth, flexion and extension here. And that's also going to help make that tissue a little bit more flexible, pliable, and dynamic. Because if you cannot manually get some adaptability into that muscle, then you're just fighting because of the, when you're doing the front crawl, you have to be able to make that muscle long. You have to be able to spread this area apart, create more space between the top of the pelvis and the bottom of the rib cage. And you don't want to be fighting that muscle. So you've got to create a little bit of dynamic adaptability into that muscle. Okay, again, doing both sides. Use the small Pilates ball and then use the more direct pressure of the more dense therapy balls. So then we're going to come down into glute med. Glute med is a muscle that also has to be not locked up, or you're fighting because of how it attaches into the QL. So if you, when you put the therapy balls into glute med, if you are feeling a burning sensation and it's painful, and you're going to spend some time here, you're just going to run along the fibers of the muscle, back and forth. And again, you're going to have to breathe so that your nervous system calms down and you really are not fighting. You don't want your muscles to fight you on this. It also helps to run the hip through external rotation and internal rotation, a little bit of adduction and abduction. And again, this is not fast work. It's going to take some time, but it really pays off. And then engage the muscle against the ball, hold it, and then release it. Contract and hold for about 10 seconds and do a series of 6 reps of that. And that really lowers the tension in the muscle and allows the balls to sink deeper into the muscle. So after you have rolled out the psoas, the QL, glute med, you're going to come onto the other side of the hip and get TFL. That is another muscle that is keeping the hip from rotating. So you're still on your side, but you're more towards the front now. And you're just going to roll out that muscle back and forth. Again, slowly. If it burns, then engage with a series of contract, hold the muscle, really just engage the muscle, contract it, and then release. It also helps to bend and straighten that leg, and that will allow more pressure from the ball to sink deeper into the tissue. You can also roll out your quads. That tends to be a really tight area, especially the lateral quad, which is vastus lateralis.
So roll from the hip down to the knee. Again, if you find a place that really just burns, then the only way out is through. Contract the muscle, hold it, and then release it. And just do a series of those until that burny sensation just goes away, and it will. And then bend and straighten as you change the length of the muscle. That helps to release the tension in the muscle. And then come all the way down to the knee. That lateral part of the muscle is going to be a little more painful and will require a little bit more time. But then come on to the front and roll out the front of the quad. Again, the same principles apply to any place where it feels like it burns. So when you have that sensation, contract and hold, bend the joint, and lengthen and shorten the muscle back and forth. And then roll clear up to the knee. Down to the knee. Okay, so we have rolled out the muscles that are kind of inhibiting the rotation of the hips. Now we're going to roll out the muscles that are inhibiting further up on the spine, because you need to be able to get rotation and lateral flexion all the way up the spine. So I like to start at the lumbar spine, just above the sacrum. And I'm not on the spinous processes here. The spinous processes are between the balls, and the pressure is on either side of the spine. That's important. So I'm going to just sit the balls here, and this is a really important proprioceptive exercise. It's an exercise where you're just really tuning in to where the balls are in the tissue, and you're paying attention to how each side feels. Are they different? Is one side more painful? Do they feel different lengths? Just really pay attention to how that feels. And then you're going to do a little bit of lateral front flexion. So on one side, you'll bring the shoulder and the pelvis closer together, and then you're going to do the other side. Now this is going to help with your ability. It's really important, especially for the backstroke and the freestyle, that you be able to do this motion and that every vertebrae has access to lateral flexion. Super important movement. And then, again, this is slow work. You're going to move up just an inch so that now you're on the next vertebrae. An inch and a half maybe. Everyone's a little bit different size. And then you're going to do the same thing. Just laterally flex from one side and the other. And if you find that there's one spot that feels a little more stuck, then spend more time there. Also, you can flex the spine. You can even come up together and run your spine through flexion and extension. And make sure that you have that movement available to each muscles of each vertebrae. And then come up. Now this may not need to be done every day or maybe even every week. Once you get that movement and you know you have it, if you're maintaining it as you swim. But the minute you start to feel like maybe you are losing a little bit of that range, then spend more time here.
especially if you take a break and you stop swimming, when you start again, you have to make sure that all of this tissue is still moving in the way that you need it to. And then you're going to come up. Same thing applies. You're going to laterally flex. Also flex and extend the spine. And it kind of changes as you get up into the thoracic area. You can put something under your head if this is uncomfortable to support your neck. And then between the shoulder blades, we're going to spend more time here building this tissue. This tissue can be really sore and uncomfortable, but we're going to first finish making sure that we have the rotation and lateral flexion that we need in every aspect of the spine. You're going to feel some popping and movement as your spine adjusts. Muscles hold bones where they are, and as you move the muscles and you change the tension in the muscles, then the bones are going to adjust. That's a good thing. We're not on any bones here. We're only doing muscles. And we're going to come clear up to the base of the skull and spend a little. I like to hold the balls at the base of the skull and move side to side. You can really get into those muscles at the base of the skull by nodding up and down and moving an inch left and right. These are your headache muscles, especially with the butterfly. It's really important that you have flexion and extension of the spine, clear up to the cervical vertebrae, clear up to your head. So this is a really important work for the butterfly stroke especially. I like when swimmers use bilateral breathing because of the therapy it is to their neck, their cervical spine, instead of just unilaterally breathing on one side. Okay, this is another area you can spend a lot of time, but we're not going to spend any more time here. Okay. So we're going to do a few exercises to make sure that you have the rotation in your hips that you need. If you come into a 90-90 position where the femur of the front leg comes straight out and then out to the side, so that if you draw a line from the heel to the knee to the back heel, that all lines up. Now, if you find yourself leaning to the side here, that means you don't have the range of motion. You want to be able to sit up straight, and you want to be able to bring your knee fairly close to the floor. So if this is an uncomfortable position, then spend more time here. Press the legs into the floor, engaging the muscles. So you're engaging everything on the back of the front leg and everything on the medial side, the inside of the leg, on the back leg, and really press in and hold for 10 or 20 seconds. Hold that. If it's shaking, that's good. That's when you know that you're making tissue changes. Press and hold and then release, and you'll find you're able to sit up a little bit straighter. And then compare sides. Is, again, line up the heel with the knee with the back heel. Is one side easier to sit up straight than the other? So again, press the inside of the back leg and the outside of the front leg into the ground and hold. Engage your core. Sit up as straight as you can. Press, 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 and see how that, as you release, allows you to sit up a little bit straighter and come a little bit more into the front leg is in external rotation, the back leg is in internal rotation. Super important, especially for the breaststroke. I find so many people do not have the ability to do breaststroke for two reasons. One, they don't have the proprioception. They cannot feel what their legs are doing. You have to be able to see with your mind what your legs are doing, and they just cannot. They think they're doing it and they just don't have that mind-body connection, but they also don't have the rotation of both the feet and the hips to be able to invert and evert the foot and to be able to run through internal and external rotation of the hips. Really, really, really important work for the breaststroke. So everything that we just did with the hips is very, very important with the breaststroke. Okay, the last thing that we're going to do here is, if it's just a Pilates exercise, if you bring your one leg in front, one leg in back, the front toes are pointing forward, the back toes are pointing to the side. And here we're just going to run through a little bit of rotation. Again, we're working on that ability for the spine to be able to rotate, but we want to be able to, at every length of a muscle, contract it. A lot of injury happens when a muscle is long and you try to engage it because it just can't do it. So that has to be trained. So as you run, press your hand into your knee, the front knee. Look for every bit of length that you can on that opposite hand, like every little bit of length. You're reaching. This is super slow, pushing that inner thigh open, looking for as much length. And while you're doing that, I want you to really breathe into your rib cage, 360 big. We want to make those muscles as long as we can, spread those ribs apart, and we're looking to contract the core, so your core is engaged through all of the different lengths here. And then you can make it a little bit faster, but continue to breathe and spread your ribs apart. But we're looking to get those muscles comfortable with contracting while they're long. And then do the other side. So really look for all the length you can, pushing this open. We're looking for rotation in the spine, and we're looking to make the muscles long while you are using them, which is really, really important. Okay, so now we have made the relationship between the rib cage and the pelvis more dynamic. We've made it so that you can rotate, laterally flex. Two very important movements with all of the strokes in swimming. Now, it's important, even though you are training for one specific stroke, it's important to do a little bit of training with all of them, because all of them are using different muscles in different ways, and they create more of an anchor, more of a strong, resilient fascial net, so that the muscles can pull against each other and support each other in their movement. The last thing that we're going to do is a core exercise that I like. It's important to have a strong core when you swim so that you're anchoring those muscles and giving them something to pull against. So if you this is a 8-point plank. You want your hands and elbows and your knees and toes to stay on the floor, and you want your elbows in front of your shoulders. That's going to allow you to recruit more muscles. You want your feet to be parallel, which means you're not allowing your heels to come inside your toes, but you're keeping them out over the smaller toes.
You're going to press through your elbows, and you're going to make sure that your hips are a little bit lower than your shoulders. And then you're pulling your elbows towards each other, your knees are pulling towards each other, and then everything pulls towards center. And this is a shaky position, but it's a really important deep core exercise. You have a lot of muscles engaged here. Your adductors are engaged. And all of those deep core muscles that support the pelvis and the rib cage together are really, really engaged here. So that's one I like to do a series of. Again, we're creating a dynamic but strong, stable relationship between the pelvis and the rib cage, and then making sure that we have appropriate ability for the spine to be able to rotate from the hips clear up to the cervical vertebrae. Now, the last complaint that I get with swimming is shoulders. And you tend to build the front of the shoulder, and then the back is so painful. So for that, I really like to roll out the pecs. If you take the therapy balls and you place them just inside the head of the humerus, but to the side of the rib cage. So between the head of the humerus and the rib cage. You're going to lay down and bring your arm out to the side. And again, this takes a little bit of time. This can be a very sensitive area. So press the arm into the floor, into the balls, and hold, and then release. You can run the length of the fibers, and then bring your arm parallel to the floor, and then rotate so your palm is up, and bring your hand behind your back. That's internal rotation. And then we're going to flip it and bring it up. And again, we're looking for the ability to get deep into these tissues and make them a little bit more pliable, a little bit more dynamic. We don't want to fight them. We don't want them to pull so hard on the shoulder that it overstretches the back of the shoulder, making it weak and painful. And this is another area that you can spend a pretty good amount of time. Again, really press the arm into the floor. Feels really good. But if it doesn't, keep going until it does, because it works. Okay, now we want to work on the back of the shoulder, because we tend to do everything is in front of us. Everything on the chest gets really strong, and everything on the shoulder gets overstretched and a little bit weak relative to the front. So there's a couple of exercises that I really love. If you just get a stretch exercise band and you're going to bring it out in front of you. Now, the important thing is that your spine isn't moving. This movement is isolated with the shoulders. You do not want any spinal extension, or you'll think that you're doing more work with your shoulders than you are. So engage your core, stable spine, neutral spine. Hold the band out in front of you. Your thumbs are pointing in, and you're going to pull the band apart. And as you do, you're going to externally rotate the shoulder, which means the thumb should now be pointing up. As you do that, you're engaging your lats, you're engaging your rhomboids, you're engaging lots of muscles on the back, and that's what we want to do. So let's just do 10 or 12 reps of those. Thumbs in, engaging your core, because you do not want any of this. This is not a spine exercise. This is just the back of the shoulder. We want to work posterior delt. We want to work the rhomboids and the lats.
The important thing is we're not just pulling it apart. We're pulling it apart and externally rotating. So give that a try and see how that works for you. Now, another thing that I like to do, you can use a stretch strap or you can use an exercise band. And you may need to start with a wider grip at first. And as your shoulder range of motion improves, you can move a little bit closer. But that's just to run your shoulders through range of motion. Again, try to isolate the spine. Engage your core. Really pay attention to the distance between the rib cage and the top of the pelvis. Don't allow it to open. We're not going into spinal flexion here. This is just a shoulder exercise. So engage your core and don't allow any spinal movement. And as you warm your shoulders up, this will be a little bit more comfortable. If it's difficult at first, then again, really work on the pec, opening the pec up. You can also work on the traps, and I'll show you how to do that. There's a couple of ways that I really like to do that. Okay, so this is a great shoulder warm-up exercise. If you feel that you need to release the traps before you can do that well, I like to take the therapy balls and I hold onto one while I place the other one into the top of my trap. Now, you have to put quite a bit of pressure through the ball to really get into that. So I push through my feet to bring my pelvis off the floor so that I have more pressure into my trap. And you have to kind of hold on to the ball or it'll slip out. Again, something that really helps to move this along is to engage the muscle. Really squeeze the ball with the traps. That can be really tender. Squeeze the balls, hold it for 10 seconds, and then release. And do a series of 6 or 8 of those. And that will really, really make a big difference in the trap's ability to let go and to be able to change lengths. Every muscle needs to be able to change lengths. And the goal is to make every muscle around a joint equal strength and length. So if you have one that's locked and isn't changing, then that is going to affect every other muscle around it. Okay, the last one that I like to do, I like to do it standing, but I don't have a lot of camera width here. So I'm going to show you kneeling. If you bring your hands behind your back, your palms are facing back, and if you need to grip wider, you can. This is definitely tricep. This is definitely posterior delt, rhomboids, and lats. So you're going to come over and bring your hands up over your head. I'm pulling the band apart. I'm really, really engaging everything on the back, but I'm also allowing the traps to come up closer to the back of my head. And it's a great trap stretch. I really love how this feels on the traps. And then when you've been here for about 30 seconds, make sure you're not getting lightheaded. When you come up, don't allow your hands to fall. Hold them up high. Pull the band apart. This is a very strong contraction. Hold them high, pull them apart, and then when you can't hold it anymore, come down. I'll try to show you what this looks like standing. Again, hands are facing backwards. Feet are parallel, knees are unlocked and soft, and come down, allowing the traps to come up, pull the band apart. This is not a passive stretch, this is super active. And then when you stand up, pull the band apart, keep your hands high, pulling, 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 and then come down. Okay, give those a try and see if your shoulders aren't more stable and less painful. See if you don't have more power. See if your rotation isn't better. and you just feel like everything is working together more dynamically and less painfully.